Hello and welcome back on Daybreak Africa, coming to you from our studio right here in Ondo City. I am still Angela Daku, and I hope you enjoyed the report of the day. Now we're diving straight into the discuss of the day, which is kidney disease, causes, complications, and treatment. And we know for a fact that kidney disease is one very serious ailment that grows over time. Sometimes the symptoms happen not to show itself the way we would expect it to, but as time goes on, it tends to just reveal itself. However, there are reasons why these things stay put in our body, and there are sometimes we would expect that these things show the way they ought to show, but it comes over time, which means our lifestyles also have a role to play in this. However, we'll be talking more about this with a medical doctor who is already in the house with us in person of Dr. Olubusayo Modupe. Thank you for joining us today on the program.
Thank you very much.
Thank you for joining us, sir.
Well, straight to the point. Recently, personally, I have discovered that kidney disease has quite been prevalent right now in our society. I don't know if it is due to lifestyle. I want to think it is due to lifestyle and some other things. But what can you tell us generally to begin with, to introduce the topic about kidney disease?
Yes, kidney diseases are common now. But the truth of the matter, I think kidney diseases have always been with us. But I think now we are diagnosing better.
Okay.
Than we used to. So that's why it appears
like it's more prevalent.
It's more. Of course, it can also be because, of course, lifestyle
matters a lot.
have a way in affecting the kidneys. Then again, not only lifestyles, chronic diseases, which is known to be on the increase, is also a major causative factor for chronic kidney diseases.
Okay.
And so, because diseases like hypertension is on the rise, diseases like diabetes, mellitus, they are on the rise.
Yes.
Either because we are diagnosing better, or actually because it's on the rise. Then all this will push cases of kidney disease up too.
No.
But you're talking about lifestyle. You said something that because we diagnose better now,
Yeah,
or
it could be one of the factors.
One of the factors.
Yes.
Or maybe lifestyle. Angela started with lifestyle.
Yeah.
That these diseases are now prevalent in Nigeria generally. I was in a conversation recently, and one of the things, sometimes we're just on Twitter, just checking. Now the X app, just checking some. So me and my friends were having some discussions, and the first thing they said was that, is it because of lifestyle? Because most people are just smoking now. Smoking had been for quite some time. Mostly because people are now drinking alcohol more now. We've been drinking alcohol for years and all. But why is it that these diseases are more prevalent? Like, I was doing my research on kidney disease actually, and I discovered, okay, diabetes is part of these things. Chronic diseases are part of these things.
Yeah.
Now, talking about, I want to base it on lifestyle generally. What exactly is attached to lifestyle that is making us have more of these chronic diseases that even leads to kidney disease? I know kidney diseases can be hereditary to an extent too, but what exactly is about lifestyle that leads to this particularly?
Now, what are the kind of lifestyles that are predisposing? One is smoking, alcohol intake, use of analgesics, excessive analgesic.
How will you base? Okay, go on.
Okay. Then, using of some chemicals. For example, those who bleaches.
Okay.
That's also a lifestyle.
So bleaching too can.
Yes.
Wow.
Okay.
That's a lifestyle. Traditionally, there are herbal concoctions too.
Yeah.
It's also a lifestyle that you have this instead of seeing a doctor
For diagnosis.
you start to take herbal concoction. All these are possible lifestyles that can affect the kidneys.
Oh.
For example, smoking majorly will destroy the vessels.
Definitely.
And if it destroys the vessels, or there's a formation of atheroma, there's reduction in blood supply to the kidney, then eventually there will be damages. Probably before we even see what exactly is the function of our kidneys.
Okay.
Okay.
Let's
Understand?
Let's
delve into that
yes.
first.
Majorly, our kidneys, we have two. Of course, there are some people who have one.
Born with it.
Born with
Yes,
one, just one
yes,
kidney.
that's
Okay, that's a
unilateral.
revelation.
So we are supposed to have two. And really, our kidneys are located nearer to the back than to the front. Two. And majorly what the two kidneys does, one is to assist us in passing out waste products and toxins.
Okay.
That's one. It assists in the control of our blood pressure because it reduces some hormones. Three, it helps in the regulation of some chemicals, electrolytes in the body. Four, of course, it produces an hormone called erythropoietin. That's big English. But what is important is it assists in blood formation.
Okay.
It also produces another hormone that assists in bone metabolism.
Yeah.
Bone. These are the major functions
of it.
And so, then kidney diseases really can either be acute, short, or long.
Long, yeah.
That's a chronic disease. The truth of the matter, the commoner of the two is the chronic kidney diseases, and that's what is of a major public health importance, because if nothing is done, it can be counterproductive. And so with that, there's acute, short, and so most of the time we call it acute kidney
Symptoms of
acute kidney, aka acute kidney illnesses.
Okay.
Most of the time you just notice the kidney is not producing, you are not urinating. Let me put
properly.
it.
Okay.
You are not urinating, you are not making enough urine. Most of the time this acute kidney illness comes from, it will be after, for example, you had diarrhea diseases or a lot of vomiting, or there's sepsis. At times it could be past after a surgery. They just notice in 24 hours this woman is not, the amount of urine is producing is relatively lower than expected.
Yeah.
That's acute. And most of the time they try to rehydrate, they give some medication. Most of the time the kidney starts to work again.
Yeah.
Now the major challenge, the main thing you now see is this person is not making enough urine. But now when you talk about chronic disease, this problem has been on for quite some time. In fact, by the time the symptoms really show, virtually most of the kidneys have been destroyed. That is where the challenge is. By the time there's facial puffiness, The person just wakes up in the morning, notice that the face appears swollen. People around will tell you, the one person, or probably looking at the mirror, you notice that the face,
you are getting
the
fatter
face
and all
is, and as the day progresses, the swelling will reduce. So facial puffiness is one of the things. If anybody comes to you and talk about facial puffiness, we are thinking straight away it's
Maybe
a kidney issue. Then later there can be swelling, there can be easy fatigue, you get tired easily. All these things before it really gets to reduce production of urine, the person is not making enough urine again. Then of course, if nothing is done, there can be frank anuria. This person is not virtually not urinating again.
Okay.
At that stage, that person is, by that time, that person will be bloated. Every part of the body is swollen. We are not talking about only the face again.
Because no matter what, the waste must at least accrue to a particular place.
The truth of the matter is, once the kidney more than 50%, 60% is destroyed, that means the functions,
It's gone.
the kidney will not be able to perform its function optimally. Then waste products will start to accumulate within the body. The electrolytes will start to accumulate.
Yeah.
What acid-base balance, which is one of that with the
Proper test here.
is not being controlled. The BP is not being controlled. Production of blood
It's not being controlled.
is reduced. There's problem with the bone too, because the function is now no longer optimal. And if that occurs, then of course you see everything from tiredness, everything,
Swollenness, all those kinds of things.
everything.
Becomes manifest, and
Yeah.
I don't know. You made a mention of something, especially bleaching. I don't know. People know these things, but they don't.
I don't think they are knowledgeable enough to know that bleaching can actually
cause this.
affect your kidney.
Yeah, you know, when you bleach, you are removing,
The pigments.
what's it called, layers
The
of your
outer layer of
skin.
your skin.
And so naturally, if I put something there, it should not really penetrate in. But by the time I have removed several layers
On it already.
from this skin, that means anything you put easily can become absorbed. And one of the things they use is mercury. One of the chemical is mercury, which is injurious to the kidneys.
You also made mention of excessive use of analgesic.
Yes.
The way I was going to quote here.
You wanted to call
I
it.
wanted to ask, at what point do you say taking analgesic becomes excessive?
Now, there's a particular disease entity. We call it analgesic nephropathy.
Okay.
It is the analgesics, that's pain relief, that caused the kidney disease. The truth of the matter is this: number one, if you don't need analgesics, you don't need to take it. One, there's no rule that says after the day's work compulsorily you must take analgesics. That's what people do, and all these things will accumulate gradually. And in the local parlance, virtually when people finish the day's work, they go to a chemist. There is a concoction, they call it a compo, of different analgesics. You just go there. They are already packed everything together.
Yeah.
Can be almost 3-4 different types of analgesics, because probably they've gone to farm, they've worked the whole day,
Yeah, and they are
believe
kind of
there's
tired.
pain, and people do this virtually every day. This will accumulate. The truth of the matter is, all drugs are chemicals. So
One way or the other.
yes. So if you don't need it,
Don't use it.
you don't need to use it. The most popular analgesics we have, I'm not advertising for them, the most popular that everybody knows, can even cause liver problem. The most popular. And so if you don't need it, why must you use it?
I wish a friend of mine is watching this as we speak, because honestly, we had an argument recently, and we went on a very long travel. So by the time we all got home, we were all tired. Everybody was, because where we went for was a wedding. We are all extremely tired. We wanted to rest, we wanted to sleep, and the next thing, someone does, oh, I have these guys, let's just take this so that the pain will just be.
Just pop it.
I was looking at them as we were taking it, and the next thing we're like, Josh, take this, drink. I was like, at least the pain will go down. I said, no, I just need a bath. When I have my bath and I sleep,
And you rest,
I'll be
you'll be okay.
But it became a literal argument on the spot that you are the one that asks I to know and all that. And I was like, me, I don't even know it causes kidney diseases. I just know when you know you don't need something,
You don't
why
need
should you
to
take
take
it in the first instance? So I don't know. Now, you're talking about this thing based on, I think I'm a bit done with the lifestyle part and some of the little things we do that we don't actually know it's wrong. But I saw something now, I saw the fact that it's hereditary too as well. At what point does one begin to notice signs of this and begin to work out ways to just avoid it?
Yes, it depends. For example, there's a disease of the kidneys called polycystic kidney disease.
Okay.
That one is hereditary. And so, of course, if nothing is done, in fact, most of the time, the polycystic kidney disease will first lead to hypertension. In fact, one of the causes of secondary hypertension is polycystic kidney disease. Of course, you might not know, except you have a scan done of the kidneys. And so, when we talk about prevention, one of the simplest prevention messages, go for health screening. If you go for health screening, for example, you have a kidney scan done, you note that if there is, what is it called? For example, polycystic kidney, yes, you know you are seriously at risk of having hypertension and eventually developing
a kidney problem.
a chronic kidney disease. And you know you must walk. You know, this kind of people are not the kind of people, let me say, that will be on, will be smoking, will be bleaching, will be taking excessive. This kind of, all this combination, if everyone comes together, the end result can be counterproductive. Well, what's, for example, even having a family history of hypertension, you're already at risk of having hypertension. Of course, if you have hypertension, you're already at risk of developing
A kidney
chronic kidney disease. The same thing with diabetes. So once you know that, that you even have a family history first, you need to be very careful. If there's anything you can do not to develop the chronic disease on its own, do it. And so if you now develop chronic disease, then either hypertension or diabetes, then it's important you need to manage yourself optimally so that you don't develop.
I guess we'll pick up from there when we get back from the break. When we get back, we'll dive into the second part of the discussion. So just stay tuned. We'll be right back. Welcome back. Before that short break, we were on a discussion with a medical doctor in the house on kidney disease, causes, complications, and treatment. We have with us Dr. Modupe, who has been speaking on this before that break. Thank you so much for coming once again. I must say I'm really enjoying this discussion and I'm really enlightened. Yeah. Well, before the short break, you talked about the, we're talking about the hereditary part of the chronic kidney disease and how it can develop over time, coming from one symptom or one other disease to the other. Now, by the time one discovers that you have a hereditary chronic kidney disease, symptom.
You have a disease.
More like you have a. Thank you very much. That can lead to it. So, what is expected of that person to do to prevent it, or is it something that can never be prevented? It must happen at the end.
Yes, that you are at risk. That's the right word. Okay. That you are at risk of developing a particular disease. In this case, chronic kidney disease. It's not 100% that you will develop it.
Okay.
You must take note of it. That's why I was trying, before the break, I was trying to say it's so important. If, for example, you have a risk factor already, then you must be specially careful. You watch your lifestyle. Very important. Not the kind of person that should smoke. Not the kind of person that should take excessive alcohol. Not the kind of person that will be abusing analgesics. Not the kind of person that will take herbal concoction without just be taking herbal concoction anyhow. Not the kind of person that should be bleaching. At least on lifestyle, manage that. Then, if you have any chronic disease, when we talk about chronic disease, we want to talk about the hypertension and the diabetes.
Yeah.
If you have, you must properly take care of these two diseases. In fact, if you have hypertension and diabetes, your BP target is lower than somebody that has only hypertension. There must be a tight
target.
Yes, BP control. Because the two diseases on its own, one of the diseases can lead to chronic. And so having two, that is double honors. That means you have two diseases on its own that can lead. And so when the two works together, it can be very bad. So that means you need to control both your sugar and blood pressure. Very good control. That people should even ask you, if someone that is not aware that you are hypertensive or diabetes happens to come across your BP or your fasting blood sugar, they should be saying, you are very lucky. You don't have hypertension or diabetes, because your BP readings and your fasting blood sugar reading is within the normal range.
But now, looking at this thing, you talked about the fact that they must be extra careful to ensure that their BP and all this doesn't get to this point. But I'm just looking at it that everybody wants to be very careful, but how to be careful is the issue. Many times people these days don't even have the funds to visit a doctor, to go out there to even say, okay, I want to check my health, I want to do all this, I want to know a bit of this. Many might not even get access to this particular free lecture you're giving to many people, but here is what I want to ask majorly. How then, for people that already have an history can they curtail this? What exactly will you advise they do? I remember I had someone very close to me who had issues with diabetes. They told the person, okay, this particular food is not good for you. But in the Nigeria we are today, I told my friend recently that if this person was still alive, because the person later died at a very old age, but if this person was still alive by now, he can't afford those foods he was using to preserve himself, because you're telling him to eat more of plantain flour, telling him to eat more vegetables. Everything is costly in the market now. So I don't know, what exactly do you think? And if it's about hypertension, the way the country is right now, everybody, I can't even check my BP as we speak.
Go and check.
You have to
Checking
check.
BP is free. Probably next time, I'm coming, I will bring my BP machine
Thank
so
you
that
for that.
you do it freely.
But how do you advise people to go about this actually?
Like the kind of lifestyle
Like
they should,
lifestyle they should adopt.
Yeah.
You know, we've talked so much about lifestyle.
Yeah.
Yes.
For virtually every of these diseases, one, if you smoke, you must stop smoking. There's no ambiguity to it.
To it.
Goodbye to shisha.
Two, if you drink, reduce your drink. But if you don't drink, you don't need to start drinking.
Okay.
Okay.
That's one.
But if you drink, reduce
Your drink.
your drinking. Salt, reduce salt intake. You know, salt, there are different types of salt, we must understand. There are some in cubes.
Okay. This is
Is
new.
it salt?
Okay.
You are just deceiving ourselves.
By calling it.
Different name.
Seasoning.
Seasoning. You are just making. Are you getting my point? I used to laugh about this many years ago. I am not sure that seasoning is still available. It's even whitish
Yes.
that they used to wash white clothes. I'm not sure if
Yes.
it's still available.
I think it's refined.
But
Yes.
I remember that
It's
to
refined.
me, if it can be used
To wash
to wash white clothes, hope that's not how it's
Washing your system.
Yeah. So salt. Then there's a particular, especially for those who are hypertensive. There is no, if perchance I'm to visit you and you decided to cook rice for me, but somehow you forgot to put salt. You know how that taste will look like. You know, there are some, because there is no salt, you now sprinkle
salt,
salt.
yes.
Salt on it.
That is
Dangerous.
a very bad practice, especially for everyone, now especially for hypertensives. And you know, if you go to any good eatery, any restaurant, on your table, you always find salt for you to enjoy yourself. Bad practice. Fruits and vegetable, there's nothing you can do to it. It's very important for our well-being. These are simple things. Lifestyle. You were talking, I think you talk about diabetes. Those old days, the limits. Don't eat this, don't eat this, don't eat this, don't eat this. Currently, we don't. There are only some specifics, like some particular soft drinks, because those contain sugar, and if they take it, it will increase their blood sugar straight away. Everything we eat goes back to sugar, glucose in our body. Everything, from the beans to the plantain, everything still goes back to glucose. Is the glucose the brain, every part of the body we use? But is the rate of change that we are interested in? So that's why we don't want them to take soft drinks that will increase straight away. So they can eat anything. But most important now, we talk about portion.
Okay.
Portion control.
Yes. Well, those old days, I don't eat this, don't eat this, and eat only this, only eat beans product. And most of them become so miserable. Eating only beans and and so eventually they will not even listen to the doctor.
Again.
They will now say something will kill someone one day.
Exactly.
So we just decide to leave, but now with this, diabetics live quite longer now.
I think that's one applause. We must actually applaud science in this particular time.
So.
And cool. But now looking at this kidney, this issue of kidney and all that. Now, are you saying that since there are chronic disease that comes into play and all that, let me just go back to let's go straight to symptoms a bit, because I think symptoms is something that we've not really dwelled and touched majorly, because we all know the symptoms. You talked about the swollen face recently.
Yes.
We talked about the fact that fatigue can come into play, but what are those very common symptoms, or those slight
symptoms that people might not pay attention to?
We don't really pay attention to.
You know, that's a challenge about chronic kidney disease. By the time it's presenting, virtually more than 70% of the kidneys
Are gone.
are gone. So the little tiredness, the little facial puffiness, the little bone pains, the truth is, before it gets to major change in the urinary output, the kidneys are virtually
Gone.
gone. Simple things. Just feeling unwell.
Unnecessarily.
Yeah. You notice you are not just well, you are tired. Don't feel like doing anything. That could be. And you see, the lesson. And we know if we pick any disease early, the possibility
Of treating it.
of survival is higher.
Yeah, anything picked early is higher.
Anything. If, for example, you picked when, for example, 20%, I'm just saying, of the kidney has been destroyed. That's better than picking when over 80% has been destroyed.
That's true.
So they are simple, just feeling unwell. Not at this stage, it's even not specific. By the time you are sure now, if you wait till then, virtually the urine output is now very low. Then that means most of the time that's already end stage kidney disease. End stage.
The end stage is
Very chronic.
Really chronic and deep.
Now what it just means is that virtually all the kidney function is gone. And for example, these people will depend solely on dialysis.
Or maybe a transplant.
And that's, yeah. But before you even do transplant, you must be doing dialysis. But you know, it will take time. You get donor, you get the patient prepared. You know, the kidney is virtually no more functioning. So they will be on, it can be 3 or 4 times transplant every week. Because the dialysis, 3 or 4 dialysis in a week. The kidney is not doing any work again. So it's the dialysis that is removing the waste products. That's what dialysis means. just circulate the blood, remove the waste product, so that the blood is waste product free. But because the person is still alive, we keep generating waste products.
Definitely, we always generate.
Are you getting my point?
Yes.
So that's why they now depend on dialysis until a kidney transplant
is given.
Well, I have two questions. Firstly, talking about tiredness, you made mention of the fact that someone will just be weak and just be tired. You don't feel like doing anything.
Yeah.
Now, I think this also has to do with fatigue. How long do you think fatigue can actually last before it is...
You get back the energy. And
exactly.
No, naturally, if after stress, naturally, you should be fatigued. But mind you, after a good night rest, you should not wake up with fatigue.
You know, I researched recently concerning fatigue, and I saw that they say fatigue could last weeks, months, in fact.
It should not, I will not subscribe to that.
Okay.
Because if what is causing that fatigue, it's stress, we have done something
Strenuous.
strenuous. Naturally, after resting,
Supposed to get the energy back.
you get your energy back. Or again, if for example, it's not only because of stress, you know, if you have a simple malaria, a straightforward malaria, you know, you wake up, you feel tired. That telling you there's something wrong with this system. And if probably you even went to the hospital, you did blood tests, they told you it's malaria, and you got treated, you are no more feeling headache, you are not feeling body ache, but you are still you still know you are feeling tired. Something is wrong, and this is a time you need to go out and check. It's not more than malaria. Naturally, after fatigue, if we can pick what is causing it, if we are treated, it should go.
Okay.
Yeah.
Then my second question, you also made mention of the fact that we should reduce salt in our food. Salt and seasoning.
So people have girlfriends that
what is the substitute to salt if one should want to reduce?
Salt. No. I'm not sure there's a no substitute for salt.
Okay.
Just learn with low salt diet.
Low salt.
I'm not
diet.
saying no.
Okay.
I'm not saying no salt.
Okay.
Low
salt.
Low. Have you tasted some people's food?
I think I did that in Anambra actually.
Are you getting my point? You'll be afraid. And you know, in Yoruba land, because you are wealthy, you don't, because of that, put a lot of salt
Put
in
more
food
protein.
because you are very rich. No, you don't need it. Of course, if it gets to us, nobody will even be able to take it. So we must manage and reduce our salt. And mind you, never sprinkle unprepared salt on your food.
You know, one of the funny things I discovered in life is that we live healthier sometimes when it's an irony of life, though, when we are broke. When we are wealthy, we live in a very, very unhealthy way. But one of the final questions I have majorly is the place of self-medication, apps taking, and all that. It's something that I discovered that many Nigerians are involved in this. A lot of Nigerians, locals, you know, you can just pass through many places and you just begin to see people just speak something. The minute you hear friends, my stop. In fact, that's not
back.
That's not even the problem majorly. It's not
Majorly
even majorly attached to even sicknesses now. We are in a generation where, okay, we have to say this, sex is on the rise. So most of the guys be like, I want to take this so that it's going to make me do this. I want to take. The next thing, they've taken it, drank it. And it's something that is now that we are even talking about it, it's affecting more. And you said something now. You said the reason why it's on the rise is because we are diagnosing better. And one of the things that scares me the most is that probably in the next few years, we'll be experiencing more of these issues
It will be more
out there. So how do you think that we can work out ways to just reduce it as soon as
It will
possible?
likely be more. It's so simple.
Oh, Jesus.
Now, the herbs, it's alcohol based, one.
Okay, we're out of time, but maybe
Yes,
to conclude.
alcohol plus herbal concoction that you don't know the content.
Yeah.
Okay.
So, and of course, there are a lot of small bottles drink, which was banned. Well, the ban has been lifted again. Different names. What's inside unknown. All this will in 5-6 years
Sure.
we'll see the effects.
Well, this is quite scary when I think about it, but well, thank you so much for enlightening us on kidney disease today. It was an enlightening
I really
program.
appreciate it, sir. I appreciate it. I learned a lot.
Please do learn a lot. You need
But
it.
then,
Well, thank you. And this is where we'll conclude the discussion on kidney disease for this episode of Daybreak Africa. I am Angela Daku.
and my name is Ikhonede Joshua Odeji. See you next time. Bye.